Okay, so it's Dr. Buford looking in the shoulder here. And of course, the biceps is already gone from the last surgery. The inside of the shoulder looks good. I don't see any significant arthritis as you look at the glenoid here. Some kind of minimal wear and tear changes from living hard, working hard, playing hard, but not too bad. Humeral head looks pretty good. But then we look up here, and here's the rotator cuff. And this is one of the things we talked about, that maybe the rotator cuff is starting to break down, and sure enough, it looks like it is. So we'll take a number 1 PDS marker stitch, and this may be something that we have to fix for you. I'm going to just debride some of the tissue that's not healthy. And you can see once we do this, yeah, we're going to definitely place an anchor down here and repair this rotator cuff, because this is becoming even more obvious that this is the problem here. Right now I'm just working on the footprint. Okay, and in just a minute we'll place a marker stitch, and then we'll go up in the subacromial space and get this fixed up for you. Okay, I just want to show you. See, we have this little purple stitch. This is just a marker stitch, but you can see it's going right through the area where the tear is. So next we'll go in the subacromial space. Okay, so here's the hole in the tendon. We've cleaned up the edges a little bit. We're going to place a suture anchor right here. I'm trying to leave as much of the tendon in place. You can see this old side-to-side suture. I'm even going to leave that at this point. And we'll just bring this all down to the bone and get it to heal. So we're going to place an anchor right about there. Okay, so we're done. We've tied all 3 sutures, and that's moving very solidly as a unit. Again, I didn't want to take away any tissue that has a chance to heal and recover. We've made some holes in the greater tuberosity to help that bone marrow release even faster. I'm going to turn off the pump, and you'll see some of the bone marrow come out of the little vents that we've made. The bone marrow is kind of, looks like little yellow droplets. There they are right there. So that's going to help things heal too. So good luck to you now, okay? Bye-bye.